Some health professionals around the country are choosing to walk away from their jobs because of a shortage of personal protective equipment. News 4 told you one nurse's story after she resigned from St. Mary's Hospital. Russell Kinsall is live outside the hospital this evening telling us about changes there. Russell?
Yeah, Steve, right now something is different here at SSM Health, St. Mary's Hospital. Different than it was when we were here last week reporting on a nurse who resigned. There's been a policy change. Nurses working in non-COVID areas with patients are allowed to wear cloth masks. Since our story aired last week, we've heard of nurses in Massachusetts and in Florida and Ohio who resigned their jobs because they were concerned that they were not being kept safe on their jobs. After 32 years of caring for patients, a nurse at St. Mary's Hospital resigned. She asked to remain anonymous.
The whole situation is just kind of terrible.
She says she was forbidden from wearing her own N95 mask while caring for non-COVID-19 patients. She worried the virus can be spread by people showing no symptoms at all. SSM Health notified us of a policy change in a written statement that says, at this time, we are allowing employees in non-critical areas who will not be caring for COVID patients to wear cloth masks. The move to a new mask policy for all SSM Health hospitals in St. Louis had been under consideration for some time and may change yet again as community conditions evolve. Now that cloth masks are allowed, I asked the nurse about her decision.
I have regrets because I left a lot of friends, and it makes me worried for them.
Stacy Foytik is a nurse in Cleveland who resigned this month because she says her hospital also refused to let her wear a mask.
I didn't sign up to put my health at risk, my family's health at risk, or even be causing where other patients would get sick. This isn't safe care. And many nurses and doctors, respiratory therapists, we have no choice.
Nurses have expressed concern about not wearing a mask because people can carry and spread the coronavirus even if they aren't showing any symptoms. Stacy is the mother of 7 and her husband has an autoimmune disease.
I had to decide, that I wasn't going to risk my kids and my husband getting sick because I was being put in a situation where we could easily get this virus if we have a patient that comes in with it.
So back here in the St. Louis area, SSM Health says that nurses can make their own cloth masks or they can wear ones that are donated by the public. And they can wear them in all areas of the hospital except for in the COVID ward or in the emergency departments. And they also said that they admit that cloth masks a year ago would have been totally unacceptable for nurses to wear, but these are extraordinary times and there is a shortage of N95 masks. And the SSM Health reiterated again that the safety of their patients and their staff is the top priority. Live in Richmond Heights, Russell Kinsall, News 4.